Okay. Hi, my name is Ted Zhu, and right now I'm going to present my health project presentation PowerPoint. This project is for HKIN 295 online, summer 2017, contemporary issue in health. Professor is Jack Remmer, and my topic is talking about the body health related to smoking and passive smoking. According to World Health Organization, there are some key facts on tobacco use. Tobacco kills up to half of its users, and it kills more than 7 million people each year. More than 6 million of those deaths are the result of direct tobacco use, while around 90,000 are the result of non-smokers being exposed to secondhand smoke. Also, tobacco smoking has many negative effects on human bodies. For example, they may cause lung cancer, they may cause chronic obstructive pulmonary disease, or emphysema, asthma, and also cardiovascular disease. The reason for choosing this topic is because I have had asthma since I was a kid. I was an infant, about 2 years old. And smoking is the main factor that influences my respiratory health. When I was a kid, I used to be at my father's restaurant where people were allowed to smoke, and there was no specific rule that restricted smoking in public area. Therefore, the environment was really bad for me to live. And when I turned to high school, the air pollution and air quality in Beijing was really bad. Not just for me, it's for all citizens to live. So my parents decided to send me study abroad. So I came to Canada. The reason for choosing this topic is because it is related to my future career. And I want to learn more about diseases related to smoking and exposure to secondhand smoke, so that it will be beneficial for me to help people or help patients who smoke or exposed to secondhand smoke. Therefore, my question would be, do smoking and passive smoking bring negative effects on body function? And my answer regarding to the question is that smoking and passive smoking both have negative influences on body function. They may cause predisposition to asthma and chronic obstructive pulmonary disease. They may also cause cardiovascular disease like hypertension. Moreover, it is important for pregnancy women to avoid smoking or exposure to the secondhand smoke because they may affect fetus or infants and causing them to have predisposition to asthma or COPD before and after birth. So the first study is about low birth weight related to exposure to environmental tobacco smoke. The methodology was used that 20 pregnant women were examined with the age of fetus falling to 23 to 30 months and 31 to 33 months. So the results shows that environmental tobacco smoke has adverse effects on fetal growth based on maternal smoking. Less exposure to secondhand smoke would result in smaller effect on fetal growth, and morbidity would be expected higher if women were exposed to secondhand smoke during pregnancy. Another study related to infant health is small gestational age. This study tests the hypothesis that women who deliver small for gestational age infants are more exposed to passive smoking. The method used a cohort of nulliparous women in Sweden, about 72 people, and among 1 year, there are 87.7% of women who complete the questionnaires during their first prenatal visit. The result shows that passive smoking in early pregnancy causes high risk for delivering infants who have small gestational age. Besides the risk for infants from prenatal smoking or exposure to secondhand smoke, gender difference also have different responses to smoking among men and women. So in the third research study, it reviews the difference of physiological responses between men and women to the combination of stress and smoking. The population selected includes 36 males and 34 females, and the methods were measuring the systolic and diastolic blood pressure, heart rate, plasma epinephrine and norepinephrine, and cortisol concentration. They were measured arrest smoking and right after giving a speech. And the results showed that for both men and women, tobacco smoking can contribute to some cardiovascular disease through sympathetic activities, which increase the concentration of plasma epinephrine, heart rate, and blood pressure after smoking. However, females and males have different responses to stress and smoke. According to the data from the measures, it shows that men had greater increases in sympathetic activities than women, that they have a higher cardiovascular activities, and for plasma cortisol, the level of epinephrine concentration is greater exists in men that cause a larger cardiovascular response. Even though men have significant responses to a combination of stress and smoke, having increased heart rate and blood pressure, but there is a greater chance for female smokers to cardiovascular disease than men, because women are usually more stressful than men, and it's hard for them to quit smoking due to stress effects. So in the last research study, it is more about psychological effects of smoking, and the study is to explore the prevalence of reported respiratory symptoms and disease according to smoking burden, age, and gender. The population was selected of 65,717 people, and 71% of them who aged 20 to 100 answered the questionnaire. And the result shows that comparing the prevalence of symptoms of current asthma among women and men with the same smoke burden or daily cigarette consumption, women are more vulnerable to the effect of tobacco smoking than men. And evidence shows that women have raised their influences on pulmonary functions, including lower and faster decline of forced expiratory volume, which is a key element to observe respiratory disease like chronic obstructive pulmonary or asthma. The results of these 4 studies show many aspects of health issues related to smoking and passive smoking that consist of low birth weight and short gestational age for infants, and men have higher physiological responses like higher cardiovascular activities than women, and women are more vulnerable to smoking than men due to stress. What I think the most important thing is the exposure to secondhand smoke for pregnant women, because it is also associated with fetal growth, and the environment was really hard to be changed for them, and there's no proper protection for them to avoid tobacco smoke. The limitation part for my first study that the data was chosen from Canadian and US government website, and articles were limited to EBSCO-host database FJ4. Within the EBSCO-host database, the engine was used by Medline and American Thoracic Society. The population that were used in the studies were only consist of children and adults. When I doing the research, the question was always under the topic of effects of smoking and passive smoking. And for future research, I would suggest to study the treatment for smokers. And while I examine journals and articles, I only find few research that focusing on using electronic cigarette to replace tobacco cigarette. But I think this could be one of the treatment to quit smoking. Also, I want to study the medications and side effects on human bodies, especially for asthma, because this is my current chronic disease. And last, I would recommend to study the relation of stress and smoking, and how physiologically and psychologically can tobacco relax the stressed individual. Yeah, that's it. That's my presentation. Thank you.